want to talk about a stomach ulcer. Stomach ulcer is a source or a wound that develops in the lining of the stomach. Normally, our stomach is protected by a mucous lining or a saliva-like substances that prevent the stomach from the stomach acid or juice that are produced in digestion of food. The problem comes in when the thickness of that lining is reduced, and many things can cause the reduced stomach lining. First is the presence of a bacteria known as a Helicobacter pylori. That organism can be gotten from unwashed fruit, vegetable, suyas, and other things. And once it gets into your body system, they start to attack the cells of the body or the cells that produce saliva-like substances that protect the stomach from being harmed. In such case, the stomach lining will be severely affected and the protection will be wear out, giving a room for attack or a damage by the stomach acid known as hydrochloric acid. The second major cause of a stomach ulcer, you are using a pain reliever like your life depends on it. You use it consistently. Those pain reliever, we call them non-steroidal anti-inflammatory drugs. Those drugs are drugs like diclofenac, ibuprofen, aspirin, and many other pain reliever which we use daily for pain relief. Once you abuse them, they will cause your stomach lining to reduce and the wound will set in. The other things that can cause it are when you depend so much on smoking and taking of alcohol, it reduces your immune system, which you are susceptible to those microorganisms and they can easily affect your system. Now, let me tell you the symptoms of a stomach ulcer. The stomach ulcer, the wound does not develop only in your stomach, it can also affect your small intestine, it can affect your esophagus. The one that develop in the small intestine or the earlier stage of the small intestine, we call it the duodenal ulcer, and the one that develop in the food pipe, we call it an esophageal ulcer. The main symptoms are heartburn. You'll be feeling something is burning in your stomach or in your chest. That is the first sign of ulcer. The second sign, you will lose appetite to eat, or when you eat, there will be indigestion. You feel sick. You lose weight consistently. What is happening, you don't know, but you are not strong as before. Some people, after eating a fatty food, they will be bloating or gases everywhere. Those are the signs of stomach ulcer. Now, for you to identify that you have a stomach ulcer, you need to carry out a laboratory investigation. And those laboratory investigations, they are going to run an H. pylori test for you to determine if there is a presence of Helicobacter pylori in your body system. And in a complicated ways that will need an advanced investigation, they will carry out a procedure known as gastrectomy in a standard hospital. And that test is done to look into your stomach lining to know the particular place in which it has been affected. Now, let me tell you the complication of a stomach ulcer. In the complication of the stomach ulcer, first is bleeding. Once you have a wound in your stomach and it has resulted into a complication to the extent that it has affected a blood vessel in your stomach muscles, now there will be an internal bleeding, and that bleeding can cause you to be anemic and many other things in your system. The second complication is perforation. Your stomach will be perforated to the extent that it can affect the other organs within the abdominal cavities. And the last one which I want to talk about is obstruction. Have a stomach ulcer, it will affect the movement of the food that you are eating through your system, in which there will be a severe obstruction. Now, stomach ulcer is treatable. Many people has been thinking that it's not curable, it's not this. No, the early detection and treatment is the best. I am not going to suggest any medication for you to use as a treatment, but once you notice those signs that you are having a stomach ulcer, kindly visit a healthcare facility where more investigation will be carried out and a proper treatment. This video very important to you, and if you learn something from there, share it to your family member, your friends, your colleagues, so that they will learn and know the benefits or how to prevent stomach ulcer and how to take immediate action once they are having the sign of heartburn and the other signs that I have just mentioned. Thank you.